There's been plenty of excitement and concern about how the coming revolution in artificial intelligence could upend parts of our lives. But one giant benefit could be changes in medical care. AI has been called medicine's biggest moment since antibiotics, with the potential for diagnosing rare illnesses, developing new treatment options, and exciting new drug discoveries. Brooke Silva Braga put the endless possibilities under the microscope.
In some ways, this is how new drugs have been discovered for decades, creating compounds, then seeing if they fight disease. But that painstaking, almost artisanal process is starting to look very different.
When I was in school, I used to have to do that. Now we've got a robot that does it. Yeah.
So these youngsters don't know how good they have it with their thumb and forefinger.
Easy street.
Automating the lab, though important, is the least of it. Don Bergstrom, the president of research and development at Relay Therapeutics, says a revolution in drug discovery could cure cancer in the next 50 years by bringing new approaches to once impossible problems.
The number of potential chemicals that could be a drug is larger than the number of stars in the universe.
Really?
Traditionally, in the lab, you'd have a collection in a freezer of 100,000 different chemicals. And over the course of weeks, you would take each one of those chemicals and put it with a protein.
Okay.
Computationally, overnight, we can look at not at 100,000 compounds, but at 1 trillion compounds.
Then, after the computer has virtually screened those trillion, just a few hundred of the most promising get physically tested.
These are essentially very, very sensitive scales.
A key part of that selection process is using new computing methods to better understand the proteins they're targeting.
We just want to turn off this one, not turn off that one over there on the left.
Okay, but they look basically
the same, right?
Yep.
Yeah.
By learning the difference in the movement of extremely similar proteins, Relay says they can now target the ones causing disease without hurting healthy tissue and causing side effects.
But this protein moves more slowly than this protein does.
Right. So you're able to put something in that'll fit there, but won't there.
Exactly, because they're just moving too fast here.
They discovered that I had a gene this medicine was able to turn off.
Marcia Merton is part of a small clinical trial testing one of Relay's first drugs. It targets a common gene mutation in tumors like her metastatic breast cancer. Current treatments don't work for long because they quickly cause severe side effects. But under the care of Dr. Andreas Vakaris at Mass General Hospital,
You look good now.
Merton has stayed on Relay's experimental drug for a year and a half.
So the little side effects that I am having, I balance out with the big effects that I'm still living my life and I'm working and I'm traveling and I'm spending time with my beautiful family.
Within 5 years, you will see a great part of the drug development pipeline massively accelerated.
Harvard's Isaac Kohane is both a medical doctor and PhD in computer science. He says technical innovations like drug discovery are just half of AI's potential in medicine. It could also totally change how patients interact with doctors. How might that work? He offered the early example of a family from Michigan.
Here is a mother whose child was fine, but now is having trouble walking, is then having trouble chewing, and then having intractable headaches. For 3 years, she goes from doctor to doctor to doctor. They get all the tests you can imagine. She takes all the text from those studies, cuts and pastes it into GPT-4, and says, "What's wrong with my child?"
The chatbot spit back a suggestion: tethered cord syndrome.
And so she goes to a neurosurgeon. Is this tethered cord syndrome? The surgeon looks at the MRIs and says, "Yeah." They do the surgery and the kid's fine.
Had doctors not thought of that before?
No. And this diagnosis is actually not that sophisticated a diagnosis.
So it's both an endorsement of the AI and an indictment of the medical community as it is.
And in fact, right now, that's my primary thesis about where we are right now. We are at a point where medicine is stumbling, killing patients by the thousands every year through misdiagnoses and medical errors.
The answer, according to Kohane, are healthcare outsiders like computer scientist Pranav Rajbukar.
Yeah, I mean, we're at an inflection point.
Who joined Kohane at Harvard. His earlier work helped prove computers could read X-rays as well as humans. In limited ways, AI is now helping doctors read some scans, but Raj Bukhar gave us a first look at something grander.
Let's jump into that.
An experimental system called MedVersa.
Circle the enlarged heart.
Instead of a series of one-trick pony algorithms,
Wouldn't it be cool if the same model could segment out the pancreas?
MedVersa can understand and diagnose
And we're going to generate a prediction here.
a wide range of issues.
So it says the main diagnosis is melanoma.
He says the model will be good enough to seek regulatory approval in about 2 years.
We're at a point at which these technologies are going to work, and it's a matter of when, not a matter of if.
The if, he says, is whether doctors will embrace them. Many so far have not. The impact on patients' health and doctors' employment remain uncertain. But Kohani envisions a new kind of doctor, a new kind of medicine,
We just don't have enough of the right people with enough of the right time.
combining the expertise of every specialist into an AI any doctor or even patient can freely access. At least that's his hope for the medical community.
If we don't take leadership in how AI is used in medicine, others will do it for us. And these others may not have the best interests of society or our patients. What if this gets optimized for the insurance companies? What if it gets optimized for a particular set of drugs? We have, as a society, to start asking for super transparency.
If AI companies aren't transparent, Kohani says governments should step in. But he's convinced massive change is coming to medicine.
The use of AI is going to be problematic, but far better than what we currently have.
For CBS Saturday Morning, Brooke Silva Braga, Cambridge, Massachusetts.
Something you keep hearing, AI is coming, right? It is. If we don't take or someone doesn't take leadership, someone else will. So do you want to take advantage of it and use it for good, or have somebody else do something that, I don't know, is maybe not as effective?
Well, it sounds like the perfect alignment of bringing a lot of information together and utilizing it quickly and giving you what you need.
With doctors.
Yes,
That said, doctors are still very smart, and you should listen to them too, but yeah. This morning, Ray Kurzweil, the inventor and futurist who's been working in the field of artificial intelligence longer than anyone alive. His new book is called The Singularity is Near, the date when he says humans and machines will eventually merge. We know it can be scary and weird to think about, but not for Kurzweil. He says it's more likely to make everything better. We met him at the Wonder Museum in Boston. You don't like the term artificial intelligence.
It sounds like it's fake. Artificial intelligence is real intelligence, and sometimes it can be better than human intelligence.
Ray Kurzweil knew he wanted to be an inventor when he was 5.
My name is Raymond Kurzweil, and I'm from Queens, New York. Queens, New York?
At age 17, he appeared on the CBS game show I've Got a Secret and revealed a computer he'd built to write music.
How many pieces of music has your machine written? Well, it's written several dozen, and it only writes short segments, and when I feel the piece has a future, I go on.
470 years ago, our fathers brought forth on this continent.
Early in his career, Kurzweil made a reading machine for the visually impaired and invented the first synthesizer.
All of the equipment that you see can be programmed by anyone, sighted or blind, to play by itself.
By now, Kurzweil's published 11 books, including his latest, The Singularity is Nearer, a follow-up to his 2005 bestseller, The Singularity is Near, affirming a couple bold predictions. 1. Artificial intelligence will be as smart as humans within 5 years.
In 1999, I made a prediction that we would reach AGI, Artificial General Intelligence, by 2029, within 30 years.
You think we're still on track for 2029?
I think that's probably pessimistic.
You keep pushing this up.
Well, Elon Musk says it's going to be 2 years. Other people saying 3 or 4 years. 5 years is probably conservative.
After AGI, says Kurzweil, comes the singularity, a term borrowed from physics, when humans and machines eventually merge. Once the stuff of science fiction like Star Trek,
am I real?
Of course you are.
it could be much closer to reality than many think.
Everything is new. Everything works.
And the brain abnormality is gone. For good.
Extraordinary.
The merging of human and machines, whether it's 2045 or a different number, scares the heck out of most people, I think, not you.
Well, do we have a negative idea that we have the amount of intelligence that a human has? I mean, maybe we should have stayed at the level of a mouse.
In other words, you're saying, if we can be smarter, why not be smarter?
Exactly, and we already are. I mean, just with having cell phones and all of our electronic technology makes us smarter than we were, say, 50 years ago, before we had all of these brain extenders.
And not just smarter, you say we're going to be sexier, more creative, funnier, all of it.
Which we use our intelligence for.
Kurzweil believes most people, consumed by bad news headlines, don't appreciate the rate of exponential growth in technology or what it can do. For example, solving our energy needs. Do you think we're still on track for all energy needs to be met by wind and solar by 2034?
Yes, because we have 10,000 times more energy that falls on the Earth from the sun than we need. And it's growing exponentially, just the way all technologies do. And that will give us enough energy, both between the sun and the wind, in about 10 years.
That seems super optimistic. That means no coal, no nuclear, no gas.
Right.
Kurzweil points to two things that he says made us capable of all these advances.
One is our brain. Elephants and whales actually have a brain that's bigger than us. Whether that means they're smarter than us, it's really hard to say, but they are quite smart.
But they don't have...
But they don't have a thumb. All the tools we've created have come really from the fact that we have a thumb.
Yeah. So it's mind and thumb.
Right.
Trying to put his thumb on when things will happen has at times been hit or miss for Kurzweil. But he has never stopped, backing his calls with dozens of graphs and voluminous research, including the claim that by the early 2030s, we will reach something called longevity escape velocity.
Which is, as time goes by, the risk of your dying will not go up. So we won't actually succumb to aging.
Does that mean we live forever?
It's not forever. I mean, you could take a 20-year-old who has nothing wrong with him, and you could compute his longevity as being many, many decades, and he could die tomorrow, right? So
an accident.
Yeah. You could also get a disease we haven't cured yet. It's not a guarantee. It just means that we won't increase our chance of dying as time goes by.
What age do you think you'll live to? And what age do you want to live to?
Why would I ever want to die? I mean, people only choose to die if they're in insufferable pain, physical, psychological, spiritual. But if they're of right mind, people want to live. And so there's no reason I would get to a point and say, well, I don't want to live anymore. So I'd like to live forever, but that's a goal.
The growing risk of tropical diseases due to climate change. The World Health Organization reports dengue increased from 500,000 global cases in 2000 to 5.2 million nearly 2 decades later. But now scientists are using new tools like drones and AI to limit the spread of these diseases. Manuel Bojorquez has the story from Peru.
Iquitos, Peru is the world's largest mainland city, which cannot be reached by road. So thick are the jungles and the waters around it, the city of about 500,000 can only be reached by plane or boat. It also means mosquitoes, lots of them. But about an hour from Iquitos, mosquitoes weren't the only things buzzing. Researchers are using drones to take high-resolution photos in and around this Amazonian village as part of a project to fight tropical diseases.
What are you looking for?
We're looking for specifically in water bodies that are potentially breeding sites for malaria vectors, for mosquitoes.
Brian Fernandez is part of the team.
So the idea is to build a model that can predict where an outbreak can be.
To even begin building that model, the team uses not only the drones, which can capture a shot every 3 seconds, but weather sensors to track conditions, even small recording devices to hear changes in what kinds of animals are roaming the area and what diseases they might bring. For the local kids, it's a novelty. But for Gabriel Carrasco, it's a way to help the children and their families. He's leading the research at the Cayetano Heredia Peruvian University in Lima.
What we are trying to do is help people in really poor areas to survive.
They're vulnerable in those areas.
Exactly.
Vulnerable in several ways. While the developing world's carbon footprint is small compared to industrialized countries, a warming planet, he says, can affect tropical regions disproportionately.
Events are more frequent. So, for example, El Niño is more frequent now than some years ago. Flooding events or extreme heat events are more intense. We observe some of these extreme events in areas where they were not previously reported as well.
All can result in ideal breeding grounds for mosquitoes. We visited this hospital in Iquitos just as Peru declared a health emergency due to surging cases of dengue, a mosquito-borne disease this young man was being treated for. Dr. Cesar Ramal Asayag specializes in infectious diseases.
If you end up in the hospital, you're not working.
Even worse to poor people because not all the people have a salary and have to take some vacation days, 3 days.
Tropical diseases cost affected households $33 billion a year in lost income and productivity, according to the World Health Organization. Which is why, back in his lab, Carrasco is working to take all the information that's been collected in the field and, with the help of AI, generate that program that can predict an outbreak.
The idea now is to how we can make those models much more accurate, much more detailed at the village level or at the level that is useful for a direct impact to the population.
He showed us just how detailed the information can be, with all those drone photos turned into 3D images to track water, even deforestation.
What could potentially come with it?
So there's a lot of studies that show that malaria mosquitoes, for example, like recent deforested areas.
Eventually, he says, the technology can help areas around the world with limited medicines, vaccines, and doctors deploy them strategically to help contain the spread. That model is still potentially years away. So for now, the team keeps searching for answers in the heart of the Peruvian Amazon. For CBS Saturday Morning, Manuel Bojorquez, Iquitos, Peru.
With medical providers facing rising levels of burnout, software designers are testing specialized AI-powered chatbots in the hopes of easing the burden of diagnosing, treating, and providing preventative care advice to patients. People can now get short, seemingly authoritative AI summaries from bots like OpenAI's ChatGPT or Google itself. But the answers aren't always accurate, as CBS News Confirm found out. Here's Major Garrett.
Google search is generative AI at the scale of human curiosity.
This spring, Google unveiled an AI overview feature where answers from Google's chatbot started to appear above search results for many health-related queries.
With generative AI, search will do more for you than you ever imagined. Just ask, and Google will do the Googling for you.
Sounds good in theory. In practice, there have been some glitches. The chatbots shared misguided medical advice that was sometimes comical, sometimes dangerous. In the first week of this new tool's use, one user said Google AI gave her tips for what you do if you get bitten by a rattlesnake that included sucking out the venom. That advice, if followed, could be lethal. The AI technology also gave advice on how to get a weeks-old baby to eat their vegetables. Physicians say infants should not eat solid food until after 6 months of age. Google AI even recommended eating, quote, at least one small rock per day, unquote, to increase vitamin and mineral intake. That advice was lifted from an article in The Onion, a well-known satirical website. Google says it has limited inclusion of satire and humor sites in overviews and removed ones that, for the wrong reason, went viral. A Google spokesperson tells CBS News, for health queries, we've always had strong quality and safety guardrails in place, including disclaimers that remind people that it's important to seek out expert advice. CBS News confirmed that some health misinformation persists on the tool. Queries about introducing solid foods to infants under 6 months old still returned tips in late June when we tested it. Searches on the health benefits of dubious wellness trends like detoxes or drinking raw milk included debunked claims. Despite the quirks and outright errors, many healthcare leaders remain optimistic about AI chatbots.
In the long run, I think these technologies are going to do us a lot of good.
One of them is Dr. Nigam Shah, chief data scientist at Stanford Healthcare.
When Google search came around, everybody was like panicking that, his patients will self-diagnose and there'll be all hell will break loose. Didn't happen. Same thing, we'll go through that phase with chatbots that, yes, of course, the new ones that are not fully formed will make mistakes and a couple of them will be bad. But by and large, having information at your disposal when there's no other option is a good thing.
Hi, I'm Sarah.
This is the World Health Organization's chatbot, Sarah. Sarah pulls information from the World Health Organization and trusted partners. But even though Sarah is less prone to factual errors, Sarah's attempts to mimic user facial expressions can be jarring.
How can I lower my risk of heart attack?
Focus on a balanced diet, regular exercise, managing stress.
Advocates of chatbots are quick to say that physicians, like bots, can make mistakes. Estimates vary, but a 2022 study by the Department of Health and Human Services found up to 2% of emergency room patients each year may have suffered harm from a misdiagnosis.
Sleep is crucial for heart health. Aim for 7 to 9 hours of quality sleep per night.
With the right design and oversight, AI chatbots might one day give better medical advice and reach more patients in need. But if you are turning to an AI chatbot for health advice today, note the warning that comes with Google's version. Info quality may vary. For CBS Saturday Morning, Major Garrett, Washington.
In today's Health Watch, we look at how artificial intelligence could at last be on the verge of opening a whole new frontier in medicine. AI is now being used to interpret imaging and flag drug interactions for possible treatments, in fact, and also help doctors with their paperwork. Doctors are very happy about that. CBS News chief medical correspondent Dr. John LaPook is here with what it means for doctors and patients as well. Dr. LaPook, glad to have you back. You're excited about this.
Super excited about it.
How do you personally use artificial intelligence in your practice?
All right, first of all, I'm a gastroenterologist, right? So I do colonoscopies. Well, there's an AI application that allows an AI app to look over my shoulder as I'm doing the colonoscopy, and it can spot a very subtle polyp even before I do. And as a show and tell, I'm bringing a tape from about 6 years ago. I had a colonoscopy.
Okay.
Dr. Mark Pachapin and Dr. Seth Gross. That's me in the white hair. And there is, see that square?
Yeah.
It finds a very subtle polyp that maybe you would have missed,
Oh, wow.
And identifies it, puts a square around it. He's Dr. Pachapin's. No, because there's no, I'm out, first of all, and there's no real sensory nerves there that can make me say, ouch. It comes out, it goes to the pathologist, and this has been shown to be more sensitive at picking up polyps, and not instead of the colonoscopist, right? It's just looking over my shoulder saying, how about this? Sometimes it beeps and it's really just a bubble of water, and sometimes it's, boy, I didn't see that.
Wow. First of all, hats off to Dr. LaPook for coming and showing us his true self.
Yes, well,
yes.
From
the sake of science.
From the inside. No, I think it's important that we demystify this, and this is a no embarrassment zone. There's also use of AI for things like mammography, helping to read mammography. And again, there's a radiologist there, but the AI app is looking over the shoulder and saying, hey, what about this?
So this is better for patient care, but can there be negative effects? Like there's always like the concern for false positives, right?
Yeah, and that's why, we have to be in the middle of it. As doctors, we can't say AI is something's going to happen to us. It's something that we're going to be very involved with. As an example of that, I spoke last night to Dr. Paul Testa. He's intimately involved with helping to make technology more helpful and more prevalent in the hospital using computational devices and AI. So he told me some of the things that are happening that are they really lit me up, okay? One of them is, when you go into a hospital, there's tons of information. That's words that are just in the chart, right? How do you analyze all that? So I saw somebody yesterday who had, a year ago, had a very big procedure, and then it took me about 20 minutes to go through it. Well, what they're experimenting with is taking all that language, so large language analysis, natural language analysis, and summarizing it. And so that I could come look at the summary. If I want to look at the actual note, I could have a link to it and say, okay, that's what happened. Then on top of that, it can do analysis of what's going on in the hospital. So for example, somebody writes a note saying, I think this person should be started on blood thinner. And it gets lost in the sauce. Nobody does it.
Yeah.
Well, there can be an agent, a computational agent that's saying, hey, wait a second, somebody ordered this and it wasn't done. And then a little friendly reminder to maybe do that.
Yeah. You think there could be some areas where AI replaces human beings entirely and is not just an assistant, but the
primary?
Yeah, I don't see that happening, and I think the way it's going to not happen is if we take an active role, like we're doing at NYU Langone Health, where I'm a professor of medicine, I should say in full disclosure, and other medical centers are doing that, which is, no, the interaction, the human interaction with a real person I think it's irreplaceable.
The bedside manner.
The bedside manner, although you know what the computer can't do?
Yeah.
It can't do that, okay?
For now.
And there's value in that. But what it can do, and here's one of the things that a couple of years ago, a woman came into my office, and I've known her 30 years. She said, hi. And I said, what's the matter? And she started crying. Her life was falling apart. It was too big of a hi. And I can imagine that AI could be looking at the last 10 years' conversation and say, hey, you know that tone of voice? Think about asking her about anxiety.
So exciting. And you're so right. We have to be in the driver's seat of all of
We
this.
have to be in the driver's seat.
Dr. John LaPook, thank you for always being here.
A legend in well-being, Deepak Chopra has been at the intersection of science and spirituality for almost a half century, meeting world leaders and celebrities alike. Now the best-selling author is out with his 95th book, Digital Dharma. He sat down with Meg Oliver in his Manhattan apartment for his first network interview about it and explains why he believes artificial intelligence is the key to unlocking personal and spiritual growth.
A 9/11 in the heart of New York City.
Nirvana, enlightenment, is the ultimate reality.
World-renowned meditation guru Dr. Deepak Chopra neutralizes the noise.
What is my deepest desire?
Leading more than 2,000 yogis through meditation in search of peace.
Why is meditation important?
The mind is never at peace. So you have to go beyond the mind to the source of both the good and the bad, the up and the down, the pleasure and the pain. It's not happiness, it's peace. Once you're at peace, everything is possible.
What is my purpose?
At 77 years old, the legend in well-being is leaning into artificial intelligence to find peace as well.
This is the future of AI technology.
Digital Dharma explores how AI can elevate spiritual intelligence and mental health.
Why did you want to write this book?
While people are all painting doomsday scenarios with AI, you can use AI for self-reflection. You can use AI for research as a research assistant. You can use AI as a health coach, both physical and mental.
Chopra likes to describe Dharma as the life you're supposed to live. Digital Dharma explains how to use AI to accomplish that.
One of the chapters is titled The Art of the Prompt.
The Art of the Prompt.
What is the best way to ask AI for guidance?
Think of AI, even though it isn't, as a friend. Even give it a name. Say, I am Deepak, you're Susie, you're Michael. Can you give me some research on what's the best method for me as a person, Deepak, to go to sleep at night? And the machine is not intelligent. Okay, it's a database, but it's an amazing database because it has database of philosophy, of science, of spirituality. It's like Aladdin's lamp, you know. You use it correctly and a genie comes out of it and it can solve any problem that you have.
Chopra was born and raised in New Delhi, India, but moved to the U.S. in his 20s, where he began his career as an endocrinologist. A prominent figure in the New Age movement, he became famous for teaching household names from Oprah and Michael Jackson to meditate.
That's one of the most famous artists in India of all time.
Chopra's travels and philosophies are on display in his apartment, along with gifts from world leaders, a space he calls a wellness home.
What does it mean to live in a wellness home?
It means to actually experience what my obsession is. Energetic body, love and compassion, clear mind, and lightness of being.
Today, the spiritual gangster has more than 15 million followers on social media.
What we experience, including our body-mind, is a virtual reality, a simulation. You know, I do actually one video a day, and my only goal to use social media is just that: joyful, energetic body, loving, compassionate heart, creative mind, and lightness of being.
Chopra launched his own AI endeavor called digitaldeepak.ai in May.
To meditate, find a comfortable position and close your eyes.
I think a lot of people will be concerned, how can you guarantee that they're actually getting information that you would tell them?
Well, because it's not a large language model. It doesn't go through search engines. My digital Deepak only has access to what I've said in the past and updated it also. So right now, you can ask it for advice on health and spirituality. But soon, it'll get you to know you better than you know yourself. And then it'll tell you, you know, you didn't sleep well last night because you were having an argument with so-and-so, or you were stuck in a traffic jam. Now, it's up to you how much you want to use it, but it's all anonymous. So your data is forgotten as soon as it's given to you.
The country is suffering from a mental health provider shortage. Can AI fill the gap?
Yes. I think that's the only way to fill the gap, is through AI, through algorithms that monitor your well-being and that can give you not only advice, but actually help you in the moment to tackle your distress.
We're living in such a divisive time right now. Can artificial intelligence help people lead a deeper spiritual and elevate their personal well-being?
Absolutely. I think artificial intelligence is the only way to create a critical mass of people who want to be healthy and joyful and hang out together. Have you thought of your final exit? At the end of your life, are you going to say, my life had meaning and joy and love and compassion? Don't waste it on getting sick right now and then spending all the money you've earned to get better.
Striving for a better way to live in a digital world. For CBS Saturday Morning, Meg Oliver, New York.
It's interesting to think about, you know, how can artificial intelligence help us connect in sort of more real ways or natural ways with ourselves and the world around us.
And I still have so many questions when it comes to AI, especially about privacy. But I do, if anything can make mental health resources more accessible, then I think that's a great thing.
Yeah, well, he helped me with my mental health. He and Oprah in their meditation series. I did buy one of those. You don't think so?
I know, I said okay.
No, but so if getting his word out, the idea of meditation, because it really does bring this sense of calm. I just love the look on Jeff's face.
We need the calm now.
Yeah. Right.
We should do some deep breathing.
So that's what I do in the morning, Jeff.
Okay, you want to show me?
That's what I do.
Excellent, love it.
Deepak Chopra and Oprah Winfrey, how about that?